Did you know that stretching a stroke survivor's limb the wrong way can actually make things worse? The key is working with the muscle and not against it. And in this video, I'm going to show you exactly how to do that. In this video, I'll show you the safest way to perform passive range of motion and stretching on a stroke survivor's arm and leg. And we'll go through some key techniques to help you avoid pain, reduce the stiffness, and promote better recovery. So be sure to check the timestamps below to skip to where you need to go. Before we get started, it's important to know that if our muscles and joints aren't moved regularly, they will not only become stiffer, but they will eventually shorten, becoming locked in place, leading to permanent joint and muscle contractures. But simple interventions such as passive range of motion, which is just moving the joints in a back and forth movement, and stretching, which is holding a stretch position, can dramatically reduce the risk of developing these contractures. They will also help prevent blood clots and improve circulation. For best results, passive range of motion and stretching should be done at least once a day for mild to moderate spasticity and twice a day for moderate to severe spasticity. Passive range of motion should be done at least 5 to 10 times per joint being moved. Just make sure to move slow when you're stretching and mobilizing the stroke survivor's joints. And when you do encounter some stiffness, make sure to hold a stretch for 20 to 30 seconds and repeat that 2 to 3 times within that 5 to 10 rep range. And now let's go through a few quick safety tips. Always move the limbs slowly and gently. Never do a jerky or quick movement, as this can cause the muscles to tighten up and can be quite painful. Next, you never want to force a movement. When you encounter resistance in the muscle, that's either muscle stiffness or spasticity. If you force a spastic limb, it's actually going to make their spasticity worse, and it's going to be quite painful. Instead of forcing, just pull back a little bit on your stretch and hold a gentle stretch and allow for more time for the muscle to relax. Next, you want to watch for discomfort. You can do this by watching their facial expressions or by watching their body movements. A little tension and pull in the muscle is okay, that's what we're looking for, but pain is a red flag. If you notice they're in pain, ease up a little bit and continue with the stretch. And lastly, we want to support the joint fully as we go through these exercises. Always hold the joint you're moving with 2 hands so there's no unnecessary strain. Now let's get into the stretching for the upper body. Start off with making sure the person you're working with is in a comfortable and supported position. This can be either lying down or sitting back with good back support. Now we'll begin with the shoulder movements. When ranging the shoulder, always support the shoulder by holding onto the elbow and the hand. Also, if the shoulder is limp or flaccid, always push the humerus, the arm bone, up into the shoulder socket to support the joint to reduce pain and risk of damaging the rotator cuff. Maintain that position as you move through these shoulder movements. Starting with shoulder flexion, gently lift the arm towards the ceiling, stopping at shoulder height or when you feel resistance. Slowly bring it back down. Repeat this movement 5 to 10 times, always moving slowly and gently. If you feel stiffness, hold the stretch for 20 to 30 seconds for the first 2 to 3 reps. Now we'll move on to moving the arm out to the side. Hold and support the arm the same way as the first movement and gently bring their arm away from the body to about 90 degrees. Repeat this movement 5 to 10 times, always moving smoothly and gently and stretching any stiffness in these muscles like before. Next, we'll stretch out the chest muscle. This muscle can get really tight and stiff and pull the humerus forward, making shoulder movements more painful. To stretch this muscle, support the elbow with one hand and give a moderate push on the humerus near the armpit back towards the bed. Then slowly move the elbow with your other hand towards the bed, giving it a stretch. Hold this stretch for 20 to 30 seconds and repeat 2 to 3 times. The last shoulder stretch we're going to do is stretching out the external rotators. This shoulder movement can be quite painful for many stroke survivors, but it is a necessary one. Support the shoulder as you did with the previous movements and bring the elbow to a 45-degree angle from their body. Gently stretch the rotator cuff by moving the wrist back towards the bed. Move slow and stop when you encounter resistance. After holding the stretch for 10 seconds, if they feel like they've loosened, you can gently move the elbow further back towards the bed. And hold another 10 to 20 seconds before releasing the stretch and resetting the movement. Repeat this movement another 1 to 2 times depending on stiffness. Moving on to the elbow. Hold the arm in the same position and slowly bend their arm so the hand moves toward the shoulder, making sure to turn the palm facing them. Then straighten the elbow, turning the palm in the opposite direction. Repeat this 5 to 10 times. If the arm is locked in a flexed position due to spasticity or severe muscle stiffness, don't force it straight. Instead, hold a gentle stretch for about 30 seconds to let the muscles relax over time. Do this 3 times to get a good stretch in the bicep. Moving down towards the wrist, start by supporting the elbow on a pillow. Then let the fingers be relaxed and stretch the wrist back, holding if stiff. Then release the stretch and move in the opposite direction. Hold this stretch for 20 to 30 seconds and repeat 2 to 3 times. Now let's move on to palm up and down. It's important to support the wrist at the hand and at the forearm. You can use a variety of different grips, but this helps reduce pain at the wrist as you stretch these muscles. Again, hold each stretch for 20 to 30 seconds if stiff and repeat the range of motion 5 to 10 times. For clenched hands, never pry the fingers open quickly. This can actually trigger a strong spasm and be painful. Instead, start by massaging and moving the palm of the hand for about a minute or so. Then slowly open up their fingers and provide a gentle stretch. Don't forget about bringing the thumb out and back as you're opening up the fingers. Again, hold each stretch for 20 to 30 seconds if stiff. If you can get the fingers straight, you can even start bringing the wrist back to get an even greater stretch. After releasing, bend the fingers into the palm of the hand to make a fist. Be sure to get the thumb around the first finger to make a complete fist. If you can get fingers into the palm, you can then start to bend the wrist the other way for an even greater stretch. Hold this stretch 20 to 30 seconds, then repeat this sequence 2 to 3 times. And now, let's move on to lower body passive range of motion and stretching exercises. Start by holding their affected leg at the ankle and on the outside of the knee. Slowly push their knee towards their chest, then slowly straighten it back out. Move within their comfortable range. Repeat 5 to 10 times and holding this position if tight for 2 to 3 reps. If possible, with their knee close to their chest, you can also bring their heel towards their butt to get a gentle stretch in the quad as well. Hold this stretch if tight. The next stretch is internal and external rotation of the hip. Hand placement is the same, and you will rotate the ankle inwards and outwards. This can be quite painful for some, so move gently. Repeat 5 to 10 times and holding this position if tight for 2 to 3 reps. Next up is stretching the hamstring. For stretching the hamstring, grab one hand under the ankle and the other will support the knee, making sure to keep the knee straight. Bring the ankle up, maintaining a straight position of the knee. Hold this stretch for about 30 seconds and repeat 3 times. Next, we're going to stretch hip adduction and abduction. Hold the leg at the knee and the ankle and move the leg slowly out to the side. Try to keep the hip from rotating outward. Then bring the leg back over and cross the other leg. Keep movement small and controlled, avoiding any twisting or discomfort movements. Repeat 5 to 10 times and hold any position that feels stiff. Now onto the foot and ankle. Support the foot with one hand under the heel and gently move their foot back and forth with the other hand. As you move the foot back, stretch the calf for about 20 to 30 seconds and repeat this for at least 3 times. Repeat this movement another 1 to 2 times depending on stiffness. If this video was helpful to you, then be sure to check out the next video in my stroke recovery basics series on how to safely transfer a stroke survivor out of bed when one side of the body is completely paralyzed. You can check that video out here, and I'll see you there.